been a while since I've done these.
That's funny.
Um, well, thank you. Yep, I've been working at St. Mark's just over 2 years now, and now I'm primarily more in the outpatient orthopedic realm. So I get to see a lot of feet, a lot of different diagnoses that we're going to talk about today. This whole presentation is mostly just going to be an overview of kind of commonly what we see, some of the general things that I feel comfortable giving to everybody that you can start working on to help prevent some common foot pain and kind of limiting your chance of getting foot pain in the future. But we'll go ahead and get started. So a couple objectives. I'll go over kind of the general anatomy of the foot and ankle, some of the main topics I'll teach people, but nothing like in depth that we really need to know about. Talk about some common foot ankle injuries and what you can do to help manage them or prevent them, and where to go afterwards if nothing that you're doing is working. And to basically learn when to see us versus a podiatrist or both. Okay, so we'll go over anatomy of the foot and the ankle. So we'll talk about the ankle first. The true ankle joint, like we like to talk about, is made up of your tibia, fibula, and your talus, which is kind of that little weird shaped bone right here. Both of those provide a lot of stability laterally. So, most of the motion occurs, forward and backwards. But the bony anatomy of the foot and ankle provides a lot of dynamic and static stability. So while you're walking or while you're standing, there's stability there. You also have a bunch of ligaments that attach there that provide more stability in different positions of the foot. Generally, they're a lot stronger on the inside of the ankle versus the outside. If you think about ankle sprains, or if you've had an ankle sprain before, it's more likely going to be the ligaments on the outside that get stretched as opposed to the inside. You also have a bunch of muscles down in your lower leg, like your calf muscles and your ankle dorsiflexion muscles, that provide dynamic stability in the ankle while we're moving, while we're going upstairs, that sort of thing. If we slip on a surface, they try to help out a bunch. Then we move on to the foot. Foot, you've got a lot of bones, 26 bones that all connect with each other. You have a lot of ligaments that attach to those bones that provide a lot of stability there. You also have intrinsic muscles of your foot that help provide arch support. They help provide distribution of load as you step or as you land on your foot, so that those joints and those ligaments don't have to take up all of the force. They also help provide a lot of dynamic and static stability inside the foot. Next, we'll move on to common injuries that I'll see a lot in the clinic. Number one, plantar fasciitis. We see this a lot. Generally, it's inflammation of the plantar fascia or areas around the inside of the heel that will get inflamed. Generally, we'll see pain first step in the morning, and pain with prolonged walking or prolonged standing are generally the cardinal signs. Also see this a lot of people are like changing their footwear and they start noticing something, or they change their activity levels and they're doing a lot more. But it's usually described as kind of this sharp burning pain right at the base of the heel, kind of in the arch. And sometimes they'll see things on imaging, like commonly they'll see like a bone spur or something. Just having a bone spur doesn't mean that you have plantar fasciitis. Just having those changes in the bony congruency of that plantar fascia doesn't mean that it always equates to pain. So sometimes patients will get, a foot X-ray and they'll see this and they're like, oh my gosh, I have plantar fascia. Well, if you don't have pain, then you don't have plantar fasciitis. Commonly, things that you can think about treatment-wise, shoes are number one line of defense. Essentially, you want good arch support, but obviously this is different from person to person because all of our feet are going to be a little bit different. So you may need something with more of a pronation or supination support And that's where talking to your physical therapist can be helpful because we can assess those sort of things. In general, you want decent arch support because with plantar fasciitis, it's often the collapse of the arch that causes inflammation into that plantar fascia attachment. So more often than not, you need more support. Generally, you want like a neutral back part of your shoe, nothing that's like pushing you too far forward or too far back. I like this white shoe right in the middle. It's a Hoka. And a pretty solid midsole. So especially if you're standing or doing a lot of walking or activity while you're standing, you want something that provides support long term, so that you can manage some of the pressure, some of the forces as you're doing more activity. Big stretching components. You want to stretch your calf. You want to stretch a muscle called soleus, which makes up a part of your calf muscle. You can see in these pictures here, one of the guys has a straight leg. One of the guys has a bent leg. That stretches both of those muscles. You also want to work on stretching your big toe. When you stretch your big toe, you're actually stretching your plantar fascia too, which helps manage some of that pain right at the heel. As far as strengthening goes, you can curl the toes, work on a lot of those intrinsic foot muscles we talked about. Same with arch lifts, where you try to make that foot as short as possible and you really try to lift that arch up off the ground. You could work on specific calf strengthening with heel raises, and just improving ankle range of motion can be really helpful. As far as like pain, like if things are really, really flared up by the end of the day, or when you first step in the morning and it's not getting better, you can always do a little massage with frozen water bottle or a golf ball. But if things are not resolving with anything that you see here or try, you can always contact your PT or go to a clinic and see if you can get in to get some treatment. Any questions so far? See anything in the chat either?
I don't see anything in the chat. Feel free to use the chat, or if you want to unmute and ask questions too, that would be great.
All right, moving on to the next one. Another one I'll get asked a lot about are bunions, which is basically, the first metatarsal bone abducting kind of as we age or as we change, like as we get older, causing this kind of deformity with the first metatarsal head in our foot. It's really quite painful when it gets inflamed or, after a lot of walking, and it does really change our walking pattern, which can alter a lot of different things. Can change what's happening at the knee and at the hip, and can cause hip pain. So it's one of those things that you definitely want to get an opinion on to see how much it's affecting you, and if it's really causing a lot of severe, walking changes, gait changes. You should be taking a look, like talking to a podiatrist, talking to a PT, and see what we can do. Most of the main cause of bunions is actually genetic. So if you have family members that have had them, you're more likely to develop them. It's a little bit of a misconception that shoes or like very narrow shoe boxes cause bunions. They haven't found in the research that it's a causative factor, but they can't rule it out. So it may be related, but it may not. Definitely related to irritating symptoms. Have a bunion deformity and you're wearing really narrow shoes, that's not going to make it feel better. Generally, it's diagnosed, visually, you'll see it, and there's going to be pain right at that bunion deformity too. As far as treatment goes, there's things physical therapy can try to do. There's no real change that we can make for the actual deformity, but we can manage symptoms and we can help strengthen around the foot and at least give options for, managing the walking pattern. And same with the podiatrist, there are bunionectomies where they'll go in and correct it. Those are helpful cosmetically. Sometimes they help with pain, sometimes they do not. So it's really a conversation you should have with your podiatrist if you're going to pursue the surgical route. As far as recommendations from a physical therapist, just like narrow shoes can irritate the bunion, we want wider shoe boxes. So I think this picture is of an ultra shoe. You can see how big the toe box is. So it leaves a lot of space for that deformity, so you're not rubbing against it for prolonged periods of time, and you allow that pain cycle to kind of calm down. You can also try like over-the-counter orthotics, splints, separators. At least in the literature, these have been shown to not be as effective, but if it's helpful pain-wise, you can definitely try it. As far as exercises, pretty similar to plantar fasciitis. We want to strengthen around those intrinsic foot muscles because that can help. You want to work on toe mobility as well. So your PT can help teach you some toe mobilizations that you can do at home to help manage some of the range of motion of that big toe. Next one we see a lot of is ankle sprains and kind of chronic symptoms after ankle sprains. So when you roll your ankle, basically all that's happening is it's stretching the ligaments past normal ranges. When you have a very high or high intensity ankle sprain, we'll say, sometimes the bony structures of the tendons can get involved as well. Worst case, like big ankle sprains can cause bony fractures of your foot, in which case you need to have casting or surgery to correct them. Normally, these are just like low-grade ankle sprains are going to be stretching of the ligaments, which can cause a lot of swelling pain initially, weakness to the ankle, tender to touch, and it's very common. About 75% of people will have at least one ankle sprain, and of those 75, it's like almost 90% will have a second one. So if you have one ankle sprain, it's very likely that you could end up having a second ankle sprain. I think it's within 6 to 18 months. So that's why it's really important to follow up with a PT if you have an ankle sprain, because we can give you things to help manage some of those symptoms and help prevent other ones. General healing timelines, like we talked about, like I mentioned earlier, if you have a low grade, it's between 2 weeks to 2 months. High grade ankle sprains with ligament tears or with bony involvement can take 8 months to a year to fully heal. And that's just tissue healing. Pain wise, things tend to be a little bit quicker. That depends on how you're rehabbing it. We used to treat ankle sprains with this RICE method, which meant rest, ice, compression, elevation, helping manage swelling. But they've actually found more recently that we want to do more of a police strategy where we load it, we add ice for managing of pain, we compress if there's a lot of swelling, and we elevate if there's a lot of swelling. But the important thing is to actually keep the joint, keep the ankle moving. There's been new research out actually on ankle bracing that even if you've had a previous ankle sprain, you want to actually brace if you're going to be in any sort of sports or athletic type activity that could cause an ankle sprain. You want to use it a little bit prophylactically. So like, having it with you and wearing it if you are at risk for doing having another sprain. As far as PT goes, we work a lot on making sure the ankle range of motion is really good, making sure all the muscles are working through all of the planes in both weight-bearing and non-weight-bearing positions, working on your balance, working on ankle stability, making sure you're walking with a good pattern so that we're not causing any hip or knee pain or knee issues. And really talking about prevention, right? To having that conversation of maybe you should be wearing a brace while you're playing tennis or while you're going to hike, because that can be helpful at preventing another ankle sprain. Next one I'll commonly see is Achilles tendinitis. This one is more common in runners, so not something you see a lot of in just the general population. But it's essentially irritation or call it tendon damage, just above the insertion at the heel bone. It's usually caused by repetitive loading of the Achilles tendon, like when you're running, and it's impacted by ankle mobility, calf tightness or weakness. Generally happens if you're a little bit more overweight. And more often than not, I'll see this in patients that, are at one level of activity and they drastically jump up to a higher level of activity, like your weekend warriors or, people starting to, going from a couch to a half mile or a couch to like a half marathon without properly training because those tendons are not used to it. Generally, you'll have pinpoint tenderness right over that Achilles tendon. It's going to be more painful when you point your toes up. As far as treatment goes, it's really good to see a physical therapist. We see this a lot, and we have good research and good treatment strategies for this. Right at the beginning, we kind of will assess shoe wear, we'll assess range of motion, and work on improving muscle length of the calf, improve any of the ankle range of motion that's needed, start working on gentle loading to tolerance. There's good research that shows that you can start loading those tendons pretty early on, and there's a couple parameters that your physical therapist will know about to keep working them. You can use ice, you can use heat, whatever works to help manage some of that pain throughout the day is great. Once we're through those early stages and the pain starts coming down, we can really start gradually loading and working on all the things functionally that you'd like to do, whether that's returning to tennis, returning to running, being able to go up the stairs, whatever it is your functional goals are, we can work on treating that and getting you back into whatever you want to do. Now we're going to talk a little bit about diabetic and vascular foot care because this is, like Melanie was talking about, I did a long rotation at the VA in Cincinnati, and this was primarily the population we worked with. So there's a lot of changes in the foot that can happen if you have uncontrolled diabetes, any sort of peripheral vascular disease or peripheral arterial disease. These kind of equate to you too. With uncontrolled diabetes and not taking care of your feet, it can lead to toe amputations, foot amputations, ankle amputations, and those are definitely preventable if you're able to follow these things. So the changes in the foot that can happen with like uncontrolled diabetes or vascular changes, you get a lot of decreased blood flow down in those areas. You'll see dry skin, flaky skin, really poor healing if you do have an ulcer or you do have like a cut down on your foot. You'll have changes in sensation and neuropathy, which can feel like burning pain in the feet or numbness in the feet. You'll have decreased skin temperature, so things will feel really cool. You won't be able to feel like a nice warm sensation on the foot. You'll notice in late stages, you'll get weakness of those intrinsic foot muscles, which can lead to fractures later on because you're relying mostly on that bony structure to absorb all of the force that you get with walking. You'll also notice really thick toenails too. I'll see that clinically as well. What you can do to help at least pay attention and talk with your podiatrist about your foot health, daily foot checks, especially if your A1C is anything above like a 7, you should be checking it pretty regularly. There's this picture here has like a long handled mirror. Some of my patients have trouble looking at the bottom of their feet, so this is a good way for you to look at the bottom of your foot to check if there is any ulceration, if there is any redness or blisters appearing, because those can turn into ulcers pretty quickly in a poorly vascularized foot. Making sure you have proper footwear. I believe Medicare provides one or maybe 2 shoes per year that are leather and breathable. Those are the best ones. They help absorb some moisture. When you have moisture, you will, and it's not controlled, that can lead to breakdown of the skin and lead to ulceration too. So, wearing socks that are able to absorb some of the moisture and leather shoes are kind of what's recommended. I also like to talk about breaking in the shoes too, not wearing them for, 10 hours straight after you just bought them or just got them from Medicare. but wearing them for a couple hours, letting and then checking your feet, seeing where if there's any sort of rubbing or blistering that's happening, because that's important. Making sure your feet are clean daily. Checking in your toes, making sure there's nothing there, checking your shoes. I had one patient that his grandson was playing with some Legos and left a Lego in his shoe, and he totally forgot and didn't check his shoe and was walking around the Lego for 4 hours. So that's the type of neuropathy that you can sometimes, see. Making sure you're following up with your podiatrist. Generally it depends on the podiatrist, but I've seen monthly, I've seen every couple months. They'll help with managing like nail care too. So, talking with your podiatrist and making sure you have a good plan for managing your feet. Regular exercise and managing the blood sugar levels throughout the day is one of the best things that can help prevent this. Exercise helps vascular blood flow down into the feet. It helps manage glycemic control. There's a ton of benefits to just getting started on like a regular exercise program. And that's where PTs can be really helpful, even if it's for a couple of visits to get you on the right path. We can get you started on some things that can be really helpful. So as far as prevention of most of these common foot diagnoses, this is more for like if you're regularly working, but if you're sitting most of the day, regular exercise is important. Thinking about a good desk setup that's functional for you. If not, you don't have your computer screens too high or too low. You're able to move your feet a little bit. You're able to stretch out a little bit. You want good, comfortable footwear, and your PT or your podiatrist can help. Ankle foot exercises, you can go through those every couple hours if you want. Working on arch lifts or toe squeezers, stretching when you're able to get up and stand for a little bit. But really, if you're sitting most of the day, you want to try to break up that activity as much as you can with walking, with standing, with doing things that are outside of just sitting. If you are standing most of the day, like if you're working or you're doing a lot of walking throughout the day for work, you really want good footwear, good arch support like we talked about. And if you're static standing, you want to be able to shift your weight from side to side so you're not always on your right foot or not always on your left foot. It's helpful to use a step stool for this because you can then offload your weight from one foot versus the other. Same thing, regular exercise, foot exercises and calf stretching have been shown to be really helpful as well. As far as when to see who, so as physical therapists, we treat all of these things. We are able to at least help with putting you on the right path for exercises, managing pain, managing these injuries, especially if your balance or your walking pattern or any of those things start becoming involved. We want to be able to help work with you, prevent falls, prevent any of these negative consequences to having this pain. We can also get you into a regular exercise program that's safe and tailored specifically to you. When to see a podiatrist. You want to see them for any sort of diabetic foot care, vascular changes in the foot. If your bunion pain is not going away and nothing that's helping and nothing in PT is helping. If you've had any sort of fractures, you want to be seeing a podiatrist. If you're noticing any sort of changes in sensation in the feet, you're not able to feel your socks as well, you're not able to feel like if you step on something as well, you want to be seeing them. So that's basically all I have for y'all. Any questions?
We do have a couple. Yeah, we do have a couple in the chat. So one of them is how to prevent calluses or corns.
So calluses are, they're pretty benign. It's going to be related to more your shoe wear and whether there's like extra rubbing in certain areas. They're not necessarily a bad thing. It's good to have, thicker skin in areas where you do get more compression or more rubbing from the shoe. If it's causing pain, then you may want to talk with your podiatrist or your PT and see if there's different shoes that you can trial.
Okay. And then another question, as a runner, I see that there are shoes recommended for those that recover long runs. What do you recommend for runners when it comes to recovery for feet after long runs?
For long runners, I actually recommend having two different shoes. Same brand, same type of shoe, but have two pairs. Especially if you're doing long runs consecutively, like day. Mainly because the midsole of the shoe, or the squishy part, is gonna wear down over time, and it actually takes time for it to build back up. So, constantly running in the same pair of shoes, Monday, Tuesday, Wednesday, that sole is going to get smaller and smaller and smaller and just compress as that loads. So if you alternate shoes, you'll still maintain um, pretty good support from that midsole, and it doesn't compress as much. You also get a little bit longer use out of each shoe. You're alternating.
So like you're saying like one shoe Monday, Wednesday, Friday, another shoe Tuesday, Thursday,
Yes.
Saturday type thing? Okay, cool.
Yeah.
Sorry, that was my question. I just have a follow-up.
Sure.
So I do that, but my question is like after I run like 9 miles, like how do I help my feet as they're just so sore and tired? Like what do you recommend?
Um, that's a tough question. It depends on what part of your foot is kind of sore, like what's going on. Generally after long, I mean, you can do like hot water soaks, you can do Epsom salt baths, you can do ice water bottle massage if it's like your plantar fascia that's bothering you. Um, Generally after long runs, I like to instruct my patients to do a little bit of like light stretching, like calf, um, quads, hamstrings, those sort of things to help kind of cool down after you've done a little bit of like walking and your heart rate's down a little bit. Does that answer your question?
Yeah, thank you.
Yeah.
I have a question. I was
Mhm.
unfortunately injured, it's second injury in the same place, right smack in the middle of the ball of my foot. And
Mm,
with this injury, I was told the first time when they had taken x-rays that I had actually broken my toes,
mhm.
four of them, right at the onset of the ball. I don't know what you would call that. And
Okay.
that it would take 6 weeks to heal. This time, as I said, I did the same thing, but this time when they took the x-rays, they said, no, it isn't broken, that I sprained it. And yet I've got the same pain in the same place doing the same thing. And I'm
Mhm.
kind of going, okay, how can it be broken one time and sprained the other and yet
Yeah.
have the same pain?
Yeah, that's a tough one. Have you been to physical therapy yet?
They would not let me. I am still in a boot. I have a week more in the boot
Mm,
before they said that they would consider taking me into physical therapy. And I was told that I was going to be in the long haul this time for physical therapy to try and
mhm,
take care of this. But that being said, I like your idea of having the two different shoes. That's not something I'd considered. But I
mhm.
also wondered if there was something out there by way of product that you can put in as a cushion specifically for the ball of the foot, because
Mhm.
that's where I seem to have this issue right there where your toes join the ball of the foot. It's like
Yeah.
there's no fatty tissue left in the pad, and I'm just smacking bone against the bottom of the
Mhm.
shoe.
Yeah. So you're talking more towards your toes.
Exactly.
Yeah. You can obviously not right now, because if you're having a healing fracture, we wouldn't want to change anything in the boot. But you may want to look into, I think they're called metatarsal offloading pads. You can buy them
Oh,
over the counter.
okay.
They kind of look a little oval shaped, and you place them. I've seen them placed in the shoe. You can place them and wear them just like for one use if you need to. But they help offload some of the metatarsal head. So more of the pressure goes through the shaft of the bone versus the head of the bone.
Would those be something that you would recommend for while I was doing walking?
I wouldn't recommend them right now. I would wait
Right, no,
until you've
after.
healed up and they clear you to start putting like weight through your foot. But it's something you can definitely try.
Okay, thank you.
All right, we have a few more questions. Do you recommend high top shoes for ankle support?
Yeah, yes and no. I think they can be helpful. Most of the high top shoes that I'm thinking of don't provide enough support up the ankle. If you are kind of a chronic ankle sprainer, really you want more of a like lace up or sometimes they have like a BOA system where you can really tighten up the ankle support. Those are what's been found in the research to be really helpful. I don't think they've found much with just high top shoes.
All right, what about toenail fungus?
That's going to be more your PCP. Podiatry can help with that, but not physical therapy.
Not physical therapy. Okay. We have another one. I have tried several at-home therapies for plantar fasciitis, but not much relief. What could a PT or podiatrist offer, or is it just a time thing?
It's not a time thing. We have a lot to offer. There's a ton of emerging evidence with um, physical therapy being kind of the first line for any sort of plantar fascia pain, heel pain. There's a ton we can do with manual work, improving range of motion, improving gait mechanics, strengthening. There's some new research on like dry needling and other kind of new, therapy procedures being really helpful, especially when it reaches kind of that subacute chronic pain that's been there for 6 months to over a couple years. That's definitely appropriate for PT. I'm not quite sure what podiatry would be able to offer. I know they will trial some injections, but those kind of are hit and miss in my experience.
So you would suggest PT first to go that route?
Yeah, PT first,
Okay.
and then if there's still no relief, then we generally will refer you to podiatry anyway to see what's going on.
Okay. Another question, treatment of ingrown toenails.
A little bit outside of my scope, but just personally using like a little bit of floss to get underneath it and pull it up can be really helpful. Epsom salt baths can be really helpful. Generally, those will happen if you're cutting your toenails too short. So, managing some of that. Some people just genetically will have toenails that kind of come down and will ingrow. But if they're chronic, then you can always talk to your podiatrist. I know some patients of mine have had removals before if it's become a really chronic issue.
Okay. Is there anything that can be done for collapsing arches?
Absolutely. A lot of the things we talked about. There's shoe wear, there's intrinsic foot strengthening. Everybody has different types of feet. So, just having a collapsing arch doesn't mean that you're predisposed to other issues. It's when you start having pain that it's important to go and see your primary care or see your physical therapist to see what's going on, then what we can do to help. But really arch support shoes, strengthening of the foot, strengthening of everything up the leg can be really helpful at managing any sort of pain that does come from the collapsing arches.
All right. What about shin splints?
Generally, there's a lot we can do physical therapy wise.
Okay.
It's kind of more of a loading issue, where people will kind of up their training or they're doing a lot of training on different sort of surfaces and those will flare up.
Okay. Lynn made a comment, you can get orthotics made with metatarsal pads. So I think that was for another question that we had.
Okay.
How successful is bunion surgery?
I don't have exact numbers. Just clinically from what I've seen, it's about 50-50. I've had some patients have bunion surgery and the bunion comes back. So it's really a conversation you should have with your podiatrist or the orthopedist who's going to do the surgery, and get a realistic idea of what the outcomes could be and what's long-term impact. If it's really painful and things are in that kind of severe range for bunions, that may be the only option for some relief.
Okay. All right, another question. How about bone spurs? Is surgery the only treatment?
Currently, yes, but kind of like I was talking about with imaging before, just having bone spurs doesn't mean that you will have plantar fascia. Sometimes that's just a natural growth that you'll have. And it's nothing that actually causes the pain. Some of that, like with heel pain, it's, it can be the attachment of the plantar fascia. It can be muscles around the plantar fascia that are also inflamed. It can be a lot of different sources of pain. Doesn't mean that the bone spur is the main source.
Okay. All right. Does diet help with food? Oh my goodness, foot problems.
Food stuff.
Sorry.
We're already past lunch, Melanie. Come on.
I know. I didn't eat very well, obviously.
Diet can help in general with a lot of different conditions, especially if we're talking about like diabetic foot issues. Diet's huge. I don't know all the ins and outs of like you should eat X, Y, Z to help with foot pain or anything like that. But having a conversation with your dietitian could be really helpful if you have specific questions about that.
Okay. Another question. What causes bone spurs?
Generally, it's because of tension at a certain site or constant compression of an area of the bone. It basically causes this cycle of osteoclasts creating more bone at that area. Because there's pull or because there's pressure or tension, it causes our body to create more bone in that space, which is common at the plantar fascia because we have a lot of tension there and it's a lot of pull. The other sites that I'll see it is kind of along the neck or the back, and that's more, in my mind, compression of those spots that will happen.
Darlene, you have your hand up. Did you have a question? You have to take yourself off mute.
Yes,
There
I
you go.
just ingrown toenails. I went to, I've had my toes done, and this one gal, she really removed it. And the next time I went to the, to get it done, they said it was good to go, and it was really screwed up and stuff. So, I mean, to go get your toenails done, is there that area their expertise to be able to do that, or, I just wondered, just kind of your opinion. I mean, I just go get, because I have calluses and stuff. I get calluses and that. I just wondered if it'd be able to help you with your ingrown toenails when you get your nails done.
I'm not quite sure what you're asking. Like, are you talking
it's pedicures? Is that what you're talking about, Darlene?
Yes,
Pedicures?
Yes,
Yeah.
yes.
Yeah, if they're not working with a pedicurist, you may want to go into a podiatrist and see if there's something they can do. They're a little bit more specialized with like treatment of toe and nail type issues.
I went to my previous podiatrist and she fixed it up, but that hurts.
Yeah.
So I just
Yeah,
wondered
it's a pretty sensitive. Yeah, ingrown toenails are no fun.
Yeah. That was all.
Yeah.
I'll unmute myself. Thank you.
Thanks, Darlene. All right. Another question. What do you think about reflexology?
Honestly, don't know enough about it to have an opinion.
Okay. All right. Anybody else have any questions for Brady? This has been fantastic. I have learned so much about feet that I didn't even know existed. But one thing I have found, especially with getting older, feet are so important. Like it's amazing how
Mhm.
keeping our feet healthy and taking care of them, it makes a world of difference because, well, duh, we walk on our feet. So
Yeah, gotta take care of them.
pretty important. Great. All right. I think that's everything. Thank you so much, Brady. This has
No
been
problem.
so, I've just learned so much.
Good.
Just wanted to let everyone know next week's webinar is about skeletal muscle, why it's important to our overall health. We will have our own Paige Corley talk about that. We all know that muscle makes us stronger, but did you know that it also helps fight disease? Come learn more about muscle and its link to health and how to maintain it. So that should be a good webinar as well. Thank you so much for your participation, and Brady, thanks for the presentation. It was really great. All right, we
Thank
will
you.
see everybody next week. Have a good week. Bye-bye.